Nurses are heroes on the front lines of this pandemic, and with us now is Kimberly Sandor. She's the executive director of the Connecticut Nurses Association. And Ms. Sandor, thank you so much for being with us today.
Thank you so much for having me back.
I want to ask you, first of all, nurses, when they go into work, are they working more hours these days?
The nurses are, it kind of all depends. There are many nurses that are working very long shifts, and the type of work that they're doing right now is physically exhausting. And so they go in, they gear up in all their PPE, and they're going into a room. And it's really providing one-on-one care because there's just not enough PPE to have multiple nurses doing the work. So the work is physically exhausting, and they're working long shifts. And the shifts, they often don't take off their mask to get a drink of water, get a bite to eat, because, you know, we're all optimizing our PPE.
Put our viewers in the mindset of a nurse right now who is heading into an emergency room to treat someone with COVID-19. What are they thinking as they walk very close to that person?
Yeah, our nurses, we have been collecting stories from our nurses across the state because I'm not on the front line. The Connecticut Nurses Association elevates the voice of those frontline nurses so that we can advocate for them across the state. So the stories that I'm receiving are some of hope, some of worry, some of gratitude for being able to be with patients during this time. There's definitely a palpable nervousness that our nurses have when they are going to work. We don't know much about this disease. We're learning more about it every day. We are in a state where we're optimizing our PPE usage. Our PPE is our armor. It's our tool that allows us to take care of our patients and not worry. And because we're in this optimization phase and learning more about it every day, there's a worry about what we're bringing home to our families, what we might be exposing ourselves and coworkers to.
Have you had any reports of any nurses becoming sick with COVID-19?
I'm sorry, could you repeat?
Have you had any reports of any nurses becoming sick with COVID-19?
We understand that some have tested positive. I believe a nurse recently passed in the Milford area from the infection.
We've also heard, well, as you know, family members are not allowed to visit a person who is dying of COVID-19. And in that event that happens, the nurse is with that person in their final moments. What is that like for these nurses to have to go through this?
I think it's an honor. One of my nurses said it well, and if you don't mind, I'm going to read her quote.
Sure.
She said, thank you. She said, please remember the nurses are here for you, to care for those who are sick and offer comfort to those in need, and care for your family. We persevere, we succeed, and we as a community, stronger than we know and more resilient than we thought, and we are here for you. Stay home and stay safe. I think that really, I just think that demonstrates the resolve of our nurses to be there to take care of our patients and to be there with in their time of need.
We're having a little transmission problems with you, but we got most of that. We want to thank you, Kimberly Sandor from the Connecticut Nurses Association, the executive director, and of course our hopes and prayers and thank you go out to all the nurses and all the healthcare professionals across our state doing some great work these days.
Thank you so much. And we've started a Connecticut Nurses Hero Fund at ctnurses.org. So if anyone would like to contribute to support nurses meeting unexpected needs as they step up, that would be wonderful.
We have some very generous viewers, so I bet you they'll take you up on that. Thanks, Kimberly.